let's really talk hospital birth and induction. This is Dr. Diana here. I am the CEO and founder of Pump with Purpose. We are a global lactation and postpartum private practice, helping and teaching women all across the world to breast pump. I am going to be joined by Julia of Bloomin' Rose Lactation, and we're going to talk about hospital birth and induction. We know that it's about to be time for the holidays, and we know how it is. Feel the pressure to be induced right before the holiday. So currently pumping while listening. Hello, hey
Julia. Hey, how are you?
I'm
good. Good.
Look at the backdrop, looking amazing.
You know I love Christmas. I'm like, I gotta put the tree in.
Listen, we know it's the time of year, right? I was like doing some pump reviews and I had my tree in the back and I was like, well, they're gonna know it's recorded in December, obviously. So
yep.
Yes, how are you doing?
I'm doing well.
So let the community know who you are, what you do out here in these lactation streets.
You should have said pumping.
Hello. I was.
Hi, everyone. I am Julia Rose, founder and owner of Bloomin' Rose Lactation Company. I am a CBS registered nurse and IBCLC. I see patients or clients virtually in the hospital and in home. And yeah, that's me in a nutshell.
Yeah, so we did a live. So if you missed it, we did a live in October. It was all about hospital birth and lactation. And this time we knew that the holidays are approaching, especially this one because it's a long one, you know, from Christmas. If you celebrate, like to be, you know, thoughtful in what I'm about to say, if you celebrate, but other holidays are also encompassed in the month of December, in different religions and all the things. And so but we're mainly talking about, you know, that time between Christmas and the New Year. Sometimes people are, and maybe the families they think they want to be induced, or you kind of get the pressure to want to be induced. So I just want to know, like, can you just briefly talk about, I guess, your experience with it, what you're seeing in the hospitals, what you know, professional, personal, what just let's talk about it.
Yeah. So it is busy season, and it's funny because it goes with like the holiday and you're like, oh my God, all these babies are being born. And honestly, I get it. Some moms, they want to get in, they want to have that baby before the holiday, so they choose elective inductions. So around this time, we're seeing a lot of elective inductions versus like medically induced inductions. I mean, personally, I would, you know, try to wait it out and let baby come when baby is ready, because so many, you know, there's risk and there's benefits to everything. So you have to, you know, weigh your risk and benefits. You know, what are my risks of, you know, trying to hurry up and deliver because it's the holiday? So, yeah, that's what we're seeing right now in the hospital. A lot of elective inductions. People are coming in fast, even C-sections, you know, they're coming in and they're trying to rush the process, and then they're ending up in a C-section because they just want to hurry up and have the baby before the holiday. And it's so funny because I've been like picking up some extra shifts because, like I told you guys, I'm also a labor and delivery nurse that I do per diem. And so they've been needing help because they're so busy. And so I've been picking up shifts, and you know, my family is asking, I'm like, yeah, we're busy at the hospital. And they're asking, why are y'all so busy? And I'm like, because everyone wants to have a baby right now. They want to come in, they want to have that baby before the holiday. So that's what we're seeing right now with inductions. They're mostly elective, and it's because of the holiday.
Okay, so you know how you see on these social media streets, right? Everyone's like, oh, your doctor may be pressuring you, or because they want to enjoy the holiday. I haven't heard it from that perspective. So, and I'm not in the hospital doing anything. So from what you find in your realm, your world, you can't speak across the United States.
Right.
You really find that it's more families wanting it or pressure from hospital staff? Because that's a different dynamic that I didn't even think about.
And it's not even the hospital staff specifically, it's the doctors. So they also plan vacations, you know, and they also go out of town with family. So yeah, they may, you know, put in, that's why it's important to, you know, educate yourself and know how to make informed decisions, because they may put things in your head and make you feel like you need to be induced, or something may happen because they have their own agenda. They want to go out of town. They want to do stuff. So they want to get you in before they leave. So it's both. And so And sometimes the families may be saying, you know, I want to be induced or choosing an elective induction because of what they've been told or, you know, placed in their head or what they think may happen because their provider is leaving. So it's true, like, even though they are coming in with elective inductions, we don't know the background or what they're being told.
Okay, got it. So can
So
you
they could be
talk about the
forced.
difference between, well, I want to, I'm learning here that not everybody, even though I know and can assume what elective inductions mean, can you talk about the difference in like elective versus like a medically necessary induction?
Mm-hmm. So an elective induction is the client has not went into labor on their own, and they have reached, you know, 39 weeks of gestation, and now they can choose to be induced. So at that point, they would pick a date with their provider and pick a time, and they would go into the hospital and be induced by, you know, one of three measures like Pitocin or Cervidil, misoprostol, a balloon, those things of that nature to get it started. So that's elective. Medical is when something is going on. So like, say for example, they have gestational hypertension that could be leading to preeclampsia. And so to avoid it, you know, getting that far to where they're having seizures, going into HELP syndrome, you know, a whole serious ordeal, they can schedule a C-section or an induction rather, whether it's C-section or vaginal, at a certain amount of weeks to have the baby. And so that would be considered medical.
Okay, got it.
Mm-hmm.
Okay, got it. So
Yeah.
can you talk about some of the risks you may see? We're being very careful in our words here because we're not here to
Mm-hmm.
say like every doctor on the planet is going to go on vacation. Every family is actually, because their baby is going to be born in December, wants to, you know, XYZ. We're just
Right.
trying to do things to consider. So what are some
Mm-hmm.
of the potential risks you may see with either any, of course, if it's medically necessary, then those are what they are. But especially
Mm-hmm.
elective inductions, what are can
Mm-hmm.
be some of those potential risks?
Yeah. So an elective induction, say, you know, you're fine. We're just going to say you're healthy. And whatever you've chosen elective induction and you come in, you're being induced, you're starting all the interventions, and the risk are, I mean, the biggest risk is stress to the baby. You know what I'm saying? So if whatever is happening, whatever method you're being induced with can stress out the baby. This is things that happen. You're forcing your body to do something it's not ready for. So you're forcing yourself into labor to start dilating and start, you know, secreting the hormones or using artificial hormones. You know, your body isn't ready. So there's a risk that you could go in. I mean, I've seen 3-day inductions, some end well, some don't. You can go in, you can be induced, your body still doesn't do it. You're on your 3rd day. Where do you end up? A C-section. You can also go in electively, totally healthy, normal. You start the interventions, you break your water, do all these things. You end up in a long induction, 3 days. Then what? You can develop an infection. Then what does that lead to? You have an infection, you're on antibiotics. This could, you know, mess with the baby. The baby could end up in the NICU. So yeah, there's lots of risk. I mean, I just don't see, if you're healthy, nothing's going wrong, you've had a good pregnancy, it's just no reason to choose induction because of fear. I mean, a lot of it is based on fear, you know, people putting fear into you, making you feel like something can happen to you and your baby if you don't have the baby by a certain amount of time.
Okay. Let's talk through things in here, and I want to make sure you're talking. And I know some of these concepts, but I don't work in anyone's hospital. The balloon. So can we talk about the
Mm-hmm.
balloon? And can we talk about the tongs? I don't know what the tong things are called when they go in and like try to get the baby with the
Forceps?
that's what I thought. And I was like, I don't want to like say the wrong name. So
Yeah.
can we talk about the balloon and forceps? Can
Mm-hmm.
what that is and like
Mm-hmm.
the concerns with that?
Mm-hmm. So the balloon, they insert it into your vaginal, into your cervix, and then they fill it with a certain amount of sterile water. And so that balloon basically puts pressure onto your cervix to forcefully dilate it. You know what I'm saying? So just think, forcefully dilate, you know? And so think of the risk that can go with forcefully dilating yourself when you're not in labor.
And I just
Okay?
Yeah, I just want to put in the plug before you talk about the forceps, is the importance of having a lactation professional or a birth doula, midwife, someone else that may be about potentially more natural methods is. So they tried that with my sister-in-law, and I was like, she was so naive to even know. Like, you think it sounds so amazing to be like, oh, the balloon's gonna go and it's gonna blow, and I was like, wait, stop, listen.
Yeah.
Like, but everyone doesn't have a pump with purpose or blooming rose to even understand the risk. I don't even need to know all the risks. I just know that they don't always end well. And so can you talk about the forceps as well?
Yes. So forceps, I don't even, where I work specifically, providers don't use them anymore. Some places still do, but I work in baby friendly places, so they don't use them. Thank God. But forceps, they use them as a last resort for places that do. And so it's when like the baby's coming down the birth canal and something has happened where the baby has gotten stuck or the heart rate's down and they need to forcefully get the baby out fast. And so they have these forceps, and that's when they can go in and pull the baby out. So that's what forceps are. Where I work, if they need to get to that point, they'll use a vacuum, which is like a suction.
Yep, that's the other the concept. Can you talk about the vacuum?
Yes. So the vacuum, again, if like something has gone wrong in the process and the baby is not coming out of the canal, the vacuum is like a suction cup that goes on the baby's head. Most protocols is like if you're in it, and the provider like pulls, like as you push, pull, suction. And so most policies are if you have like the suctions on and it pops off the baby's head 3 times, you should not continue to pull. Obviously you have places that don't go by that and they will continue to forcefully pull, and you know there's a lot of litigation and things that happen doing that, forcefully pulling the baby out with a vacuum. So yeah, those are scary things that you don't want it to lead to that. That's why if you can avoid an induction at all costs unless medically necessary,
yes,
I would.
Okay, so let's talk through this C-section, because you mentioned it. I mentioned all the little terms, and I'm like, because I'm a regular person in this. I don't work with anyone informing people. I don't work in anyone's hospital. So can we talk about the C-section risk? Because I can't remember like at what point, if you've been in labor for a certain amount of time or had Pitocin for a certain amount of time, like then really can potentially go to C-section. Can you talk about those potential protocols?
Yes. So usually, so say if you've had an induction and you're going and then you're like an arrest to descend or arrest of dilation, meaning your dilation, you started dilating and it's just stopped, or you're not dilating at all, you could end up in a C-section. Usually, I mean, great providers will, give you up to 3 days to do that. But again, like I said, 3 days, if your water's broken, etc., and you're getting all these cervical checks, there's, a risk for introducing infection. So a great provider will allow you to keep going and do everything to avoid a C-section. Some providers will just be like, okay, it's been this amount of hours, let's go to a C-section. And some will just try to wait till the very last minute, if you and baby are safe to do the C-section. But that is a risk when going in. So usually it's like at the 3rd day, if nothing's happened, that's when they'll call the C-section. And then obviously if you're being induced, the interventions can cause an emergency. Like I said, fetal stress. Anytime there's fetal stress and the heart rate is down, they will take you emergently to the back and do a C-section, which for first time moms, it's like it's your first baby. You have to get a C-section. A lot of providers may or may not do VBACs, which is a vaginal birth after cesarean. So you're at risk for having more C-sections.
Correct. As a C-section, mine was needed to happen. So I don't personally, but I know that's not everyone's truth. My son, he needed one. Definitely know he may not have been here if I didn't have one. So I don't have so much goes down with like birth trauma with C-sections. Just like I will say, I was so naive when I was having my baby shower at work. I was like, I'm gonna be in labor for 20 minutes. And you hear us say anything else, you need a plan. You need a plan for what you need to be doing, what your goals are. Stop having people to force you on their bias or their ways of doing things, or what birth looks like, or less than if you have a C-section, or more than if you have natural, or really want a C-section. That's not in your plan, and your truth, and that's your story, and those your facts are the facts. But I want to talk about naturally. If you, we're not trying to put what we think onto you. You know, we just want to arm you with the informed decision to make if you still want to do an elective induction. That's just the beginning, you know? Like other things that could potentially happen by forcing your body in, not just the baby, not just you. Then we're gonna get to the lactation piece, because that was the goal. Well, but let's talk about naturally trying to, because like everyone's like, I'm not going to labor, I'm going to fall, I want to do this, I want to do that, take this pill and take this natural remedy to birth. And I cannot tell you the wives' tales I've heard, you know, to each his own. But are there some ways that can help a family if they do want? Nothing's wrong if you want to labor before Christmas, right? Nothing wrong personally. But you don't have to go into induction just because you want to go into labor. Like, there's some natural ways that you may or have heard of. You know, if that's not your area of expertise, that's fine. We're winging it. Like, we don't have no notes today. Now we just roll and stroll, y'all. A natural conversation. I write notes as she talks. This isn't anything like, let's meet beforehand and talk about what we're going to do today.
No, we don't.
And we just winging it, y'all. She don't know what I'm gonna say. I don't know what she's gonna say. But so she'll tell me if that's not her area. But are there any natural ways that you may find that helps people to just naturally go into labor? I mean, so of course your board is gonna bring on its own, but like, you know, just asking. I don't know.
Yeah. Honestly, there's not something that I've seen that's like, oh, do this natural thing and you're definitely gonna go into labor. Because guess what? You could do all the things. You could eat all the dates. You could walk, you could bounce on the ball, you could drink the raspberry leaf tea, and still it doesn't happen when you want it to happen.
Oh, and
I feel like,
don't forget the SEX and the don't forget the SEX. Like, people out here, you know,
you have all the SEX, and you know. I just feel like your body is going to be ready and release that hormone. Like the baby's going to put that needed pressure on that cervix for that cervix to start releasing all the hormones and prostaglandins to put you into labor. I just feel like when that time comes is when it comes. Like, we could do all the things and still it won't be in our time. Yeah.
And it's just something about like beautifully having it happen. You know what I'm saying? Like, that's just my personal, you know, I mean, I went into labor on my own. It ended up in C-section and whatever. But, you know, but let's talk about, we didn't even mean to talk about this, but we need to talk about this. This is my theory of why I had my son pooped in the sack. I had a rough, like, so let's talk about the sweeps, what is it?
Yeah, the membrane sweep.
And I want to talk about like forceful examinations towards the end. Literally, I had such a forceful examination. I was bleeding when the doctor finished, and I refused to see the doctor because, you know, I was at a practice that I had to see all the doctors, and I was the whole day and you know where before I saw him, but I saw him for like nothing that he had to touch me, you know, different monthly visits. Like, it was just, hey, how you doing? Listen to the heartbeat. Like, I signed up for him for that one, but I mean, I was not on his day at the hospital. But let's talk about the membrane sweeps. I would love to talk about your opinion on that, as well as, you know, forceful examinations.
Yeah. So I mean, honestly, this is when you have to like check your provider and let them know. Doing those examinations all the time, so many times, is not necessary. I mean, and towards the end, you just don't have to do it every time. If you're not in labor, you're not in labor. I mean, it is what it is. And doing those checks, like I said, you're introducing infection. It's painful. Like you said, when they're forceful, they don't have no compassion. It's painful. It is painful. And then, you know, people are like, oh, well, maybe she's just weak because she's saying, no. First of all, it gets so sensitive down there as the head is putting the pressure. Your vagina is starting to swell. Like, it gets very, you know, like sore. And so that's what you have to vet your provider about. And that's something that for me is like a non-negotiable. Like when we start out, like we're going to talk about these things. Like me personally, like during that process of me being pregnant, I mean, I can count on one hand of how many, you know, vaginal exams I had. And this is something that I wanted and something that I talked to with my provider in the beginning.
Yeah.
And
Yeah.
so, like you said, it's very good to be informed and not move based off fear. Oh, if you don't get this vaginal exam, you don't know what's going on. You don't know what's happening.
Yeah.
You
No,
know?
I know. And I want to say, like, I was in the hospital because I had a lot of Braxton Hicks towards the end. So, like, I thought I was going to go. I was in the hospital and he was there at the hospital. Now. So it wasn't like I didn't shoot. Like, I thought I needed that to be done for me to be cleared. Like, he was like, oh, you need to do, like, some of it was just naive. You know, I was like, okay, you say you need to do this to make sure that the baby's, oh, I don't even, like, now it just sounds so ignorant. Like, now that I'm on this.
Yeah. And now it's like, oh my God.
Yeah, of any of this stuff beforehand. And none of us, not PR nurses or anything like that, but it's just really about arming yourself with a care team that can help you to know like what you should be doing, what's not needed. But yeah, the membrane sweeps, since I didn't know, I was like, they're like, we can do it. I'm like, no.
Yeah. And then you could call like a forceful, you know, there's a difference between a cervical exam and a membrane sweep. You know, they can say, oh, we're just checking your cervix, and really they're sweeping your membranes without your consent. Yeah. And that's my thing, doing stuff against consent. Yeah. Like if I did not say you could do this, why are you doing it? Yeah. You know what I'm saying?
And I went into labor 2 days later. I was bleeding, and then I went into labor 2 days later, and like my son had already started pooping in it. Like every time I was getting a contraction, no one knew he's pooping in the sack. And I mean, I'm on this side of it. My son is okay. I know I needed a C-section, but I just want to encourage people out here, like, you know, we don't all need nursing degrees. We just need people that we can talk to, that we can make sure that like what is needed, what's not needed. You know, whatever that looks like in your comfort level for you is very, very important. Some us that under, and I don't mean like, oh, I had 5 babies before, so I know. No, I mean like someone that actually is a professional that can help walk you through like what this process should look like.
Right.
Oh, we got a few more minutes, so I want to quickly talk about, because we talked about, I wanted this stuff up front because I need people to understand, like, to make informed decisions if they're not going to get to this part. You have one that's already about, we went through all the things in there, hospital birth and lactation, but I want to quickly mention for you to talk about the induction on lactation.
So say, we'll say you're ended up in like a long induction, 3-day induction. When you're being induced, they're pumping you with all these fluids, right? And so you're getting all these fluids, you're swelling up. And so when baby is born, this could actually affect your latch. The edema around your areola and your breast from all the fluids, 3 days worth of unnecessary fluids, this could affect the beginning of your lactation journey. And also like like with the Pitocin, or say something happens at the end, retained placenta. And so if you're having an induction, and something goes wrong, it's like a domino effect. And so at the end, this could delay your milk coming in, depending how you deliver. So you can have a delay in the start of your milk, or, issues with latching. And then, some places may not know or may not be educated in what to do if you have swollen areolas and nipples and how to get the baby latched. Some may not know. And then there you are in that whole, supplementing because, you couldn't get the baby to latch.
Yeah. And even like, being in the NICU, like my son went immediately to the NICU. We were separated. There was no, like, I didn't have a choice. I ended up, no one told me how to use the pump. I didn't have my pump that I went with to the hospital, all the things that, I just want, regardless of how you choose to feed, you to be able to make informed decisions and not have those decisions forced on you from other people's insensitivity to what your goals are,
Yeah. And my biggest thing is, if you're going to choose to be induced, so you're electively choosing to be induced, be prepared. You know what I'm saying? Because you have to pick a date, pick a time, pick your hospital and where you're going to go be induced, pick your doula or pick your lactation professional to arm you with all those things that you need, to make informed consent. So if you are going to actually be induced and do all these things, or forcefully be induced, or someone putting fear in you, just make sure you have a team behind you, because that could help reduce some of these complications that could occur from induction.
Yeah. So Julia, thank you so much for your time today. Please tell everyone to find you.
So you can find me on Instagram, Threads. Everybody still uses Threads. Facebook, TikTok, all at Blooming Rose Lactation. My website is jujirose.com, and on there you will see all of my links on how to book if you need to book.
So we're going to love y'all and leave you out here in these lactation streets. I just wanted to share with you, Instagram has been Instagramming lately. They've been glitching, and I'm across my fingers and my toes that this live is going to be saved.
That it'll post.
Yeah, I already have I went live yesterday and on Wednesday, and none of them, like, they literally just ended. So hopefully Instagram has fixed the glitches. It will be here if it saves for me. So thank you so much, Julia, for your time today. It was so important for us to get this in before this holiday.
Yes.
Talked about hospital births, induction, lactation, all of it. So thank you so much for your time today.
You're welcome. Thank you for having me, as always. A pleasure.
Same here, and I will see you soon. Bye.
All righty. Bye.